Roughly a third of Californians use Medi-Cal. If Prop 35 passes, it would prohibit California legislators from using tax revenue to replace current Medi-Cal spending.
It's about protecting that money so that it actually goes to healthcare rather than other things that are unrelated to healthcare.
On 35, yes.
Prop 35 all comes down to the managed care organization provider tax and where that money goes. If Prop 35 passes, it would make this tax permanent. Some of those specialty programs that would get the money are emergency services, mental health, family planning, and prescription drugs. Healthcare providers at the rally explained the wait time for their patients to be seen by providers has become too long, which could harm their health.
Coverage without access is not coverage. This is why we need Prop 35.
The prop would also pay for existing costs in Medi-Cal. Those in favor say the decision should ultimately come from voters.
Proposition 35 gives our neighbors the opportunity to weigh in on the healthcare system taking care of their neighbor, and we want to put that decision in their hands.
The opposition says it should be left to our elected officials.
The lawmakers will no longer be able to decide how that tax is structured and really more critically how those funds are being spent.
Celine Benton-Court is a senior policy manager at California Pan-Ethnic Health Network, a network that opposed the prop. She's concerned that the tax money would only go towards specific entities.
And would hope that they would also understand that some of their patients do need the services that would not be included under Prop 35.
Meanwhile, supporters argue that addressing specialty care helps everyone.
But at the end of the day, it's about a person's whole health, and that's what this proposition is going to support.
Both sides agree that California needs more healthcare providers.
And it really just is a disagreement on how we go about that, but we all want to raise the rate. But there needs to be the ability for the public and for the state legislature to be able to evaluate the current needs and strategically invest.
It's important to note that the prop would increase payment towards doctors, including those who are advocating for the prop today. Prop 35 is now ultimately in the hands of voters, and if it passes, it would generate $25 billion. In Sacramento, covering local news that matters, I'm Juliette Smith, Fox 40 News.